Welcome to the students of Science and Technology at the secondary level. Friends, today's lesson is on health and hygiene. It's a very important component of our everyday life. What a wonderful feeling it is to be full of energy, enthusiasm, be energetic, and be able to do all the things that we want to do in our life and achieve to the best of our ability. This is a dream for one and all. But for this dream to be true, one needs one important factor, that is health. To be healthy is an asset not only for oneself, for the community, but for the nation as a whole. Certain factors like hygienic environment, balanced diet help us to remain healthy, whereas factors like unclean environment, stresses, disease-causing organisms work negatively and make us fall sick. We need to work both at personal level and at the community level seriously to remain healthy. Let's proceed and see what we are going to do in this lesson today. We will, after completing the lesson, be able to appreciate different dimensions of health and the role each one of us have to play to remain healthy. We will emphasize the importance of hygiene, personal and community health, and recognize their interrelationships. We will define disease, classify them, and explain causes, symptoms, and prevention of few communicable and non-communicable diseases of national importance. We will also discuss the role of immunity in preventing diseases, express awareness about natural immunization programs and how it prevents certain communicable diseases. We will also highlight the importance of first aid during emergencies and become familiar with a few commonly needed first aid techniques. We will express concern about increasing substance abuse among the youth especially, and become convinced of the need to stay away from such habit-forming substances. We will recognize the urgency of breaking out of such habits if addicted. We will list certain modern day techniques used as diagnostic tools for disease and disorder detection. Well, friends, let us start with the definition of health. Health is a measure of well-being. When we are healthy, we are active and live our life to the fullest. According to WHO, that is World Health Organization, health is defined as a state of complete physical, mental and social well-being, and not only mere absence of disease. It means proper functioning of the body and the mind. These three aspects, friends, that is physical, mental and social aspects of health, are well shown in this triangle. We call it as a health triangle. Observe the three hands. They are holding each other. That means the three factors go together. Only when a person is physically, mentally and socially healthy, one is called healthy. What are the health characteristics? How do we recognize a person is healthy or not? Friends, we will look for these signs in a person. Physically healthy person will be energetic, alert, will have a normal weight for his age and height, will have bright shining eyes, have all the body organs functioning normally and fall sick less often. They will have clean and clear skin, have normal growing hair of natural color and texture. There will be odorless breath. They will have good appetite and get sound sleep. What are the signs of mental health? They will have control over their emotions, balanced feelings, desires and ambitions. They will have the ability to accept the realities of life and face them. They will be confident in themselves, the ability to cope with the normal stresses of life, sensitivity towards needs of others. These are the signs of a mentally healthy person. How is a socially healthy person recognized? They have a positive attitude towards life. By that I mean, they will not be expecting everything and anything that they see around. They will judge their abilities, their capacities, and accordingly they will have a desire and a dream. They will get along well with others. They will have a pleasant personality. they'll fulfill their responsibilities or duty towards others, have healthy interpersonal relationship, be able to express and disagreement positively instead of fighting. The various practices that help maintaining health constitute hygiene. Just now we just listed what are the characteristics we look for a healthy person. But then now next question is, how do we remain healthy? The ways that help us to remain healthy are discussed under the heading called hygiene. Friends, the word hygiene has been derived from a Greek word hygeia, the goddess of health. Adopting hygienic practices and promoting hygiene in the community, schools and workplace prevents spread of many infectious diseases. The diagram just depicts some of these activities. Drink clean water, wash your hands at the required time, that is before taking food, after taking food, after visiting toilet, keep your house clean, throw your waste materials at the appropriate place, and so on and so forth. Every one of us are aware of these activities, aren't we, friends? The next topic that we are going to discuss today is what are the aspects of hygiene. They are both at personal level and at the community level. Let us take up the personal health aspects first. Taking care of oneself to remain healthy and free from disease constitutes personal health. The picture on your screen depicts some of these activities that helps you to remain healthy. The slide shows the list of the activities that are listed under personal hygiene. Balanced diet, personal hygiene, domestic hygiene, clean food and water, cooking with care, exercise, regular sleep and relaxation, and abstaining from habit-forming substances constitute personal hygiene aspects. Personal hygiene in detail will include regular bath, regular toilet habits, cleaning your teeth, washing your hair, bathing at regular intervals, and so on and so forth. I would like to go in detail regarding the balanced diet requirement. Now, the chart shows the different types of food items that we need to include in our diet. But before that, what is balanced diet? Balanced diet is one that contains carbohydrate, protein, fats, vitamins, minerals, fibers in correct proportion to meet the nutritional requirement of a person at an age and doing a certain amount of physical work. Therefore, it varies from person to person. But on the average, an adolescent boy requires around 22 to 24 kilocalories of energy, whereas a girl of that age requires about 2000 calories of energy. The chart on your screen shows in a descending order the food items that we must select to have a balanced diet. 8 glasses of water is a must. Then comes the cereals. These are fortified, that is, they are supplemented with the necessary nutrients. So, you have bread, you have cereals, you have vegetables, and each level tells you how many helpings of these you need to take every day. Observe it and follow it as far as you can. Next, we talk about community health. No one can remain healthy in an unclean environment. So, just as we need to keep ourselves clean, we need also to keep our surrounding clean. Community health is the practice of preventing diseases and promoting health of a population through organized efforts of society, public and private organizations, communities and individuals. Next, we discuss what are the various activities and programs undertaken by the government at local organization to maintain health of the people and keep them free from diseases. These are, they maintain cleanliness of the villages, towns, cities and locations through proper garbage disposal. We are talking a lot about problems we are facing in proper disposal of garbage. We have to ensure that prescribed standards in the food stores, meat and milk outlets are strictly followed. This is so because These items are a rich source of bacteria and viruses if we do not maintain the health standards. Next, organize midday meals in the schools to provide adequate nutrition in the growing children, because nutrition is essential and in required amount during the growth phase. Next, set up hospitals and dispensaries to provide medical facilities to the general public without or with minimal subsidized rates. Also organize national immunization program for infants and organize activities that increase awareness about diseases of national importance such as AIDS, TB, malaria, leprosy, etc. Friends. These are the pictures that tell you some of the community activities we are familiar with. Aren't we familiar with the polio Sundays? Friends, we need to abide by these requirements. When a Sunday is announced, if we fall into that category, we must visit these centers. This is the least we can do to ensure community health. Next shows the midday meal activity. Third one shows fumigation. During rainy season, accumulated water is a breeding space for the mosquitoes and they spread many diseases. Malaria, dengue, chikungunya are a few of them. The last one shows garbage collection by the corporation or the governmental agencies. Let us now talk about what diseases are. A condition that interferes with the normal functioning of the body is called disease. Dis-ease, you are uncomfortable, that situation is called disease. It can be as mild as common cold, sore throat, or it can be as serious as cancer or TB. So, the range is wide. What are the classification or groups the term disease is classified into? Diseases can be inborn, or we call them as congenital diseases, or they are acquired during one's own lifetime. You must have heard sometimes a baby is born with certain diseases, heart diseases, lungs diseases, or liver problems, etc. Or during our lifetime, we acquire certain diseases and we need to be treated for them. Now, acquired diseases can be communicable or non-communicable. Communicable, that is, which can spread from one person to another infected person. This will include TB, AIDS, leprosy, etc., etc. Non-communicable diseases, on the other hand, do not spread from infected person to a healthy person. There are other reasons for them. This next slide will show you what communicable diseases are and how do they spread. They spread from one person to another by the entry of pathogen or the disease causing organism. Pathogens enter our body through various means and then multiply inside the body. They can be transferred from one person to the other by direct or indirect contact. What are the ways of direct transfer of infecting agencies? They can be close contact with the diseased or infected person, the droplet infection. The infections of our respiratory tract are mostly spread through droplet infection. The examples are common cold, TB, etc. It can also be spread by exposure to contaminated food. Cholera, typhoid fall into this category. They can infect another person through the mother. That is, if the mother has, say for example, AIDS, the fetus that she is bearing can also get infected, and of course, there are ways of preventing this transfer of the disease from the mother to the fetus nowadays. What are the indirect ways of transferring communicable diseases? Formites, such as bed bug, etc., or the mosquitoes, they carry the disease causing organism for one person, the diseased person, to a healthy person. It can also be spread through formites like used utensils, towels, beddings, etc. TB is one such disease which can be spread if the infected person's personal items are shared in the family. It can also be spread by carriers like houseflies and cockroaches, or lastly through inhalation of infected droplets from the air. Influenza usually spreads through this means. Here on the screen, friends, is a list of certain common important diseases that we need to take care of, prevent us from them if possible. Therefore, the list just gives you the causative agent, the symptoms, the mode of transmission, and ways of prevention and cure. The diseases we have listed here is amoebiasis. It is an intestinal or enteric disease spread by a protozoan unicellular organism, entamoeba, and it can be spread through infected food and water. So, if we are following hygienic ways, we are drinking clean water, we can be saved from getting these infections in us. Similarly, ascariasis. Ascaris is a roundworm. It can enter our body through infected food and water. Again, hygienic ways are essential, and if contracted, it causes acute pain, digestive disorders, etc. Prevention is safe drinking water and food. Treatment, there are antibiotics available against these. Similarly, we have diseases like malaria. Malaria we keep hearing about during rainy or monsoon season. Mosquito is the vector which takes the pathogen, which again is a protozoan. Anopheles mosquito, especially the female Anopheles mosquito, sucks the blood of the infected person, and then this pathogen is transferred to a healthy person when the mosquito again goes and bites a healthy person. And the preventive measures are, we have to prevent spread of mosquito. Friends, you are aware of these methods, aren't you? Next is elephantiasis. It is a disease again caused by a roundworm, where the leg of the infected person, especially the leg, swells up enormously because these parasites go and infect or they lodge themselves in the lymphatic ducts and the passage of the fluid is obstructed. There are medications against these, so if any of us sees such a person, they can guide them to the medical center. Dengue is another mosquito-borne disease, and it is, if not treated in time, may become dangerous. Friends, TB is again a very, very important concern at the national level, because a large population of our country is infected with TB. This bacteria can be spread through droplet infection, through contact of the personal items of the infected person, and these are induced by a small congested room, people living in unhygienic condition, if they have malnourished population. So, these conditions induce the infection to spread. We need to take care of all these things. Non-communicable diseases are certain diseases which are not caused by a pathogen, but they have other causative reasons. We have just listed 3 of them. They are hypertension, diabetes, and obesity. All these 3 are rampant in our society, especially among the younger population. What are the causes? They are very related, friends. Sedentary lifestyle. We do not do enough physical exercise. We have more of desk work, lack of exercise, lack of proper kind of food. These lead to the hypertension and diabetic type of diseases. Our eating habits are changing. We have fast foods, or we call them as junk food also, very high on energy and fat. So, they are adding on to our body weight. Then there are type A personality. By that it is meant that these people, they want to reach perfection, and in order to do that, They get more perturbed, they are more tense, they get angry and are frustrated, and all these together lead to a hypertensive condition. Then there is a family history, of course. There are certain diseases like heart diseases and diabetes run in certain families. What do you do then? How do you prevent? You have to have proper awareness for the reasons for such diseases. You have to exercise regularly, do yoga and meditation practices. Friends, exercise is not only something to keep you physically fit, it helps toning up your muscles, it helps release certain types of hormones in the body which are essential to boost your morals, make you happy, and that helps you to remain away from stressed conditions. If you are happy, you can achieve everything. Avoid junk food, and increasing intake of vegetables and water is essential. Stress management, increased tolerance for others and positive attitude towards life is another aspect. Then setting one's own goal for improvement rather than blindly copying others. So each one has to assess their own capacities and then decide their goal. Then lastly, motivating people around you for practicing the above mentioned healthy habits. Communicable diseases are preventable. Since there are pathogens involved, we can take care that these pathogens do not infect a healthy person. What are the ways? Let's learn little more about communicable diseases. We are exposed to large number of disease causing agents. They enter our body every day. Our body is able to ward off most of these foreign agents. This overall ability of the body to protect oneself against the foreign agents, including the disease causing ones, is called immunity. Immunity can be of two types. We call them as innate immunity and acquired immunity. Innate immunity is present from the time of our birth. That is what we are born with. And it provides protection against the entry of any foreign body against which may be harmful to us. Skin and mucous membrane prevents entry of foreign agents into the body. Hydrochloric acid in the stomach kills the germs that reach the stomach along with the food. White blood cells, or WBC as we call them, engulf foreign particles and destroy them, and is the basis of immunization program such as against mumps and measles and polio that we are going to study very shortly. On the other hand, acquired immunity, as the word tells you, is something that develops during one's own lifetime. We acquire it during our lifetime by producing antibodies in response to the foreign bodies termed as antigens, antigen. So antibodies are developed by the infected person against the antigens that intrude our body. Many of them are pathogens, and such an immunity we call as acquired immunity. Each antigen is recognized by a specific antibody. Antibodies are protein products. They are produced by lymphocytes. They are type of WBC, and against each specific antigen, that is, for every pathogen there will be a specific antibody, because these pathogens, or in other words the antigen, are specific. Antibodies remember and recognize the infective agent that have once attacked the body and recognize and kill, they enter the body again. So once they have been recognized by an antibody, any future aspect will be recognized and they will be killed. This is known as the memory of the immune system. This immunity, acquired immunity, can be of active type or passive type. Basic difference between the two is active immunity, one develops the antibodies in their body. BCG, polio, etc. fall into that type, whereas passive immunity is when antibodies are not produced by the person, rather it is given to them. Mother's milk provides large number of antibodies to the infant born. So that is the first line of acquired defense a baby gains. Now, acquired immunity can be developed naturally or artificially. Natural acquired immunity is when we get exposed to a certain disease, we contract a disease, body develops antibodies against the disease causing organism and we become immune to it for future. Whereas artificially acquired immunity is what we induce knowingly into an individual. Vaccination is a beautiful example of artificial acquired immunity where a weakened pathogen or its products are introduced so as to develop antibodies. Then memory is developed against that particular pathogen, and in future if at all such pathogens attack, these antibodies are ready to take care of them. First aid is something that is given to a victim in accidental cases. Shock is the one type we would like to know. If a person ever meets any shocking environment, that is falls from a rooftop or meets with an accident or hears something very shocking information, they go into shock. What do you have to do? Lay down the victim, raise the leg so that the blood flows to their brain, loosen the clothes, they can breathe well, calm down the patient. If mouth feels dry, put a wet cloth, don't pour water directly into the mouth, and call doctor immediately. Then severe bleeding, children do get hurt and cut. What do you have to do? Hold the bleeding part against the gravity so the bleeding reduces. To stop the bleeding, keep a sterile gauze or dressing on the wound and press it on the wound or the cut portion with the thumb. Make the victim lie down and help him to calm down, and if bleeding does not stop, call the doctor. Dehydration is a very important situation, especially during summers, dry heat. People sweat a lot. If they don't drink sufficient amount of water to balance this loss, they may undergo dehydration. Severe dehydration cases are dangerous. ORS, oral rehydration solution, as shown on your screen, is something which every one of us can prepare with using sugar, salt and water to rehydrate the body. Burns are another accidental cases that often happen in the house. One important precaution is you have to wash the injured area under tap water, cold water immediately. Do not apply anything on them or the damaged tissue. Do not break the blisters if they have formed, and call the doctors. Fractures and dislocations are another thing. We are familiar with the children. The diagram shows what needs to be done if any bone is fractured. You have to make the area immobile with the use of certain wooden sticks, or a straight ruler will also do. The picture shows you the necessity under such situations. Our important topic is on prevention of drug abuse. Drug is something which we normally take to remain healthy. They are prescribed by the doctors to treat physical and mental illnesses. They are sold over the counter and they are called legal drugs. But sometimes there are large number of drugs like cocaine, LSD, heroin, etc., which are abused by us, and we need to be careful about them. The screen shows you the commonly used drugs among the youth these days. We need to be aware of these things. Drug addiction and dependence leads to serious professional limitations. A person cannot come out of these once they are hooked onto the drugs, and withdrawal symptoms do not allow them to be away from them. So best is prevention. We neither take to the drugs nor we suffer these withdrawal symptoms, friends. There are few negative effects of drugs listed on your screen. We have to understand why we need to stay away from them, because they not only affect our physical health, they reduce our performances, they push us towards illegal activities, they push us towards criminal activities. So we need to have a socially healthy society and we need to stay away from drugs. Our last topic today is some of the diagnostic techniques that help us to diagnose certain diseases. 3 of them are X-rays, they help us to defects in our hard tissue like bones and cartilages. The diagram shows you. Next is the ultrasound. This is a ultrasonic waves which are used, non-invasive method. Patients are not harmed. Best use of it is to monitor fetal growth in the mother's womb. And the last is MRI, magnetic resonance imaging. Friends, this technique helps us to study the soft tissues in our body and any malformation or malfunctioning of these. The diagram picture shows you what the MRI of the brain looks like. So, today what we have learnt is that what is disease, how to remain physically, mentally and socially healthy, what are diseases, what are the categories of diseases, what is importance of immunization program in our country, and then we have also learned some of the first aid activities, and last of all but not the least, why we need to stay away from drugs and remain healthy forever. Thank you. I hope you ever enjoyed the lesson today.